I think there's a lot of skepticism and hesitancy, feelings like I'm not at risk for this, or not understanding the importance of prevention, or the fact that if a vaccine is at 100% effective, it's still maybe worth taking it to reduce the risk of severe disease or protect others who are vulnerable. So I think that's a conversation that we're often trying to have.
Welcome to the Bronx Health REACH Community Coalition podcast. I'm Mariah Bernzalef, and I am hosting today's podcast. I'm the program manager of the Adult Vaccine Initiative at Bronx Health REACH, an 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. In response to recent changes in the vaccination schedule policies and the list of approved vaccines, Bronx Health REACH brought together a group of distinguished experts for a panel discussion on July 30th to address concerns many community members had about access to affordable vaccines, vaccine ingredients, common myths, and other related issues. One of the panelists, Dr. Eugene Schiff, is an attending family medicine physician and clinical director of adult and childhood vaccines at the Institute for Family Health's Stevenson Family Health Center in the Bronx. He is a current American Academy of HIV Medicine certified specialist providing medical care to people living with HIV/AIDS and has been serving patients for over 13 years. Dr. Schiff spoke about some of the concerns his patients have about vaccines, what advice he gives them, and whether there is evidence-based research proving the effectiveness of RSV, COVID-19, and flu vaccines. Does the shift in CDC's recommendations for particular vaccines, such as COVID, flu, and RSV, mean that there has been significant evidence-based research that proves these vaccines aren't safe or effective as previously thought?
I think it's a challenging question. Thank you for allowing me to be here, first of all, and also in the company of such other distinguished colleagues. I thought I had been at this for a long time, but then I see everybody else has more experience than me. So my coming up on a decade working here in the Bronx, and I think the effectiveness and efficacy of all these vaccines has changed a lot. We just have the new RSV vaccines over the past few years, and we've learned about evidence, and we're kind of expanding a little bit in terms of and changing who we're offering those to in terms of adults and children. So I think it's a bit of a work in progress in terms of understanding the impact of these over time, and the cost effectiveness and the access is definitely an issue. I'm trying to figure out the timing exactly of when to give some of these shots. In the clinic today, we sort of were told we don't have any more COVID vaccines, but we'll get a shipment in the fall. We're told for children, we can start with the monoclonal antibodies and, vaccinating pregnant women for RSV after a certain period of time. So it's kind of like trying to catch a fish, in a net at the right time. Sometimes it feels like it's difficult, but just understanding, like there was the recent article in Pediatrics that showed there was such improvements in rates of hospitalization and prevention of pneumonia and severe RSV disease with some of the monoclonal antibodies that we've been using over the past couple of years. It does seem like, while there is some, challenge and skepticism about vaccines overall, and I think the COVID, flu, and RSV vaccines may fit into that bucket. We do see some data showing the importance of all these for saving significant amount of lives. I think with the COVID vaccines, it's been hard because I remember the rollout and who were initially allowed to get the vaccines and who did come forward. We've done a lot of studying here in the clinic about racial and ethnic minorities through a CDC grant with the AFP, and we were looking at the rates of the COVID vaccines. And when there was the mandate, when it was required for work, there was actually like almost 100% rates of all across races getting COVID vaccines. And then that, once the city dropped the mandate, which was controversial, the rates went down. And now I was looking at, it's quite a low rate actually of our overall who are up to date with the most recent COVID vaccines, and for elderly who have gotten their second dose 6 months boosters. So, and if we don't have them now, like we didn't have them today, that could be a challenge to keep giving it. And what is the amount of time that we need between the vaccines for them to be effective? There was the concern that there was a waning protectiveness, and that's why we were giving more to people with immunocompromised and elderly. So it's a challenging question, but I have to individualize that with most of my patients. And in the flu shot, we just heard a lot of data about the effectiveness of the most recent season's flu shot at the ACIP meeting. So I think that's something that's actively being studied, and it'll depend on the timing of the flu season, the severity of the flu season, which was quite severe last year in terms of how many lives can be saved or how many hospitalizations can be averted, but the numbers are substantial. So I think the fact that to the extent that we can support families and the highest risk individuals, whether they're the elderly and the youngest and everybody else in terms of trying to protect the community, which you guys have been doing so much of that work in Bronx Reach, bringing these vaccines to the ground level, even with the community vaccinations in churches and mosques, trying to lower the barrier to access. Because when someone calls the clinic and they say you can't have an appointment for a few months, then, that might be time where we could have gotten a vaccine earlier. So bringing all partners in order to provide access to the vaccines is so important.
It seems like there needs to be a lot of communication between organizations that are offering these vaccines, is what you're saying, so that if somebody can't get it one place, recommending them somewhere else.
I remember being at a meeting with Dr. Crouch, and there was a pharmacist delegation or representatives, and they were saying how many more hours a pharmacy is open compared to some of our clinics, which are shorter staffed. So to have multiple sites where people can go in and get them, the pharmacy in my neighborhood where I was picking up some of my medications and I gotten one of my COVID vaccines just closed the Rite Aid, like bankruptcy. So we're seeing a lot of things which are challenging access, and but I think that's something that the health department has always been looking at different times. We had even a FEMA that's been funding has been controversial now, but like the FEMA was like providing an extra site to deliver vaccines in our same community health center with a lot of funding during the pandemic and offering incentives. So it seems like at times there's more resources than others, but these activities can be really helpful out in the community in terms of promoting vaccinations. We saw some great examples of that with the mobile vans during COVID. But then, it is depending on the funding for a lot of this.
But I do think, speaking of the pharmacies, like the small pharmacies really helped during COVID to supplement. And I know that a lot of them there are many pharmacies listed on NYC Health Map. So that's a great option in an area where maybe there's not as many clinics or health centers or hospitals available. I think it's great that Department of Health tapped into that and included the local pharmacies. I guess it just depends if people have the insurance to go there. That's the tricky part. Another question I had is, knowing that changes in vaccine policies may be stoking old myths and fears, what are the most common things you're hearing from patients lately about vaccines, and what do you tell them?
I think we're hearing a lot of hesitancy about the flu and COVID vaccines, and I don't know to what extent that's spilling off, at least into the other routine vaccines. I know at least within our organization, we've improved a lot with our rates of the pneumococcal vaccination since it's kind of been a simplified schedule. So I was just looking back over the past few years, and it seems like we're up from like 68 to 72 or 73%. So that's one area where I think like the equity of having a vaccine on site and offering it to adults who are eligible, or having like a universal recommendation, which is easier than it used to be with these 2 shots we were giving in like a year apart. So that's been an area where we've improved, and where we've seen that people are actually up taking that vaccine more over the last couple of years than they did before. So that's kind of like a success story or a area to highlight. Whereas I think like our rates of flu vaccination are a little bit lower than overall for the Bronx. Maybe we just don't know who's gotten their shots elsewhere, and we can like build that into our data. But if they've gotten it somewhere else, we may not be like counting them yet in our system as having taken it. But I think there's a lot of skepticism and hesitancy, feelings like I'm not at risk for this, or not understanding the importance of prevention, or the fact that if a vaccine is at 100% effective, it's still maybe worth taking it to reduce the risk of severe disease or protect others who are vulnerable. So I think that's a conversation that we're often trying to have, and it can be tricky. I do know that like their word of mouth and social media and some of what's in the news lately, does have an effect on our communities. So there's just competing messages that people are hearing and trying to understand the best ways to protect communities. So I did have a patient yesterday that I saw. It was an 87-year-old man from Jamaica in a wheelchair who was a polio survivor, who told me that like a famous visiting professor from England, back when Jamaica was like a territory of England, visited him, when he was a child. He was born in 1937 or 38. So, when we see the effect of some of these horrible diseases and that could be prevented by vaccines, I think that's a talking point that people may not have seen that lately. So they're a little bit more likely to refuse the vaccine or be concerned about the effects of that. But when you can see when there's a memory of what the disease, the devastation and deaths and illness that these diseases caused, and that we're still causing around the world, then that can be important to give people perspective on the value of vaccinations.
That's a great point. And Bronx Health Reach is going to be launching a campaign with videos in the hopes of promoting routine vaccines for adults, which will hopefully spur people to share their stories on social media and promote the truths, not the myths of routine vaccines. Thank you so much for sharing those stories and really vital information about the Institute and your vaccine rates. Dr. Schiff, what are the short-term or long-term effects of recent policy changes in the U.S. vaccine schedule and approved vaccine list on New York City community members' access to affordable vaccines?
I guess we are hearing in the news about people being afraid to come in to the clinic, and we're also, hearing a lot of information about, I guess, this will have an impact, I think, on, including people who may be deported or feel like their families are at risk if one, like even a caregiver brings another person in, if there's mixed status families where some people feel, are citizens and others may be afraid to access services or apply for insurance coverage, or where they, even the kind of work that you guys are doing in the churches and the mosques, it makes me wonder to what extent that can be more challenging in the current climate. So it is good to hear that, we can all work on strategies to try to, address that. But I am concerned about that for the upcoming time in the fall. And I guess it just serves more important the spaces that we can offer to continue promoting vaccination and reducing the barrier and getting over some of the other inefficiencies that we have to be able to increase access.
With the recent outcomes from the June meeting, not recent, but during the June meeting for the Center for Disease Control and Prevention's ACIP Advisory Committee on Immunization Practices, the group that provides advice and guidance on effective control of vaccine-preventable diseases in the U.S., is there any concern about a delay in the rollout of routine adult vaccines in the fall of 2025? I'm thinking of possibly COVID. It sounds like flu won't be delayed, but does anybody know if that might happen?
I think it's worth mentioning that we're seeing some disparities in access even before all this. So when I ran a quick report, we saw almost twice as many Asians or white patients that the organization had the COVID vaccine, even if it's a small number overall, and many people are still not getting it of all races, than some racial and ethnic minorities or disadvantaged populations. And with the rollout over the past couple of years of the RSV vaccines, the study cited in pediatrics was showing that socioeconomic factors and public insurance and other things were leading to some disparities. Even before some of the changes that we're seeing with the political administration and the current administration, those were sort of pre-existing disparities that I think we're going to have to be fighting against. So there's definitely reason for trying to look at those and see what we can do. But I think the health department has been very supportive of this, and the organization, at least in the Bronx, which is a community of mostly people of color and many immigrants, this is going to be definitely relevant here, and trying to reduce or eliminate some of the disparities that were already existing, but maybe even more challenging now.
What were some of the obstacles they were mentioning? that people are having?
I think with the RSV monoclonal antibody products, since it was initially in shorter supply, or maybe it was just who was given access, like in the birthing hospitals versus in their clinics, when the clinics were able to purchase it. But they just did I think a study that showed that those were still some of the disparities that they found in terms of like who was protected thus far, although the products were very effective and a big improvement over what we had before, which was virtually nothing, or just the pembrolizumab for premature infants for like a monthly injection. So there are, I think that availability is going to be better this time. So hopefully that'll reduce the disparities each year.
One other thing I wanted to bring up is, according to a report by the Kaiser Family Foundation, now it's just known as KFF, 35% of adults enrolled in Medicaid in New York State are unemployed. How might the federal employment mandate for Medicaid coverage affect vaccine uptake among adults in New York? Does anybody have any, especially among, I'm thinking also, I'll just give you the second question. How might the mandate affect immigrants with emergency Medicaid?
We also just see in the clinic, many people have a home care attendant. If that's lost, then they may not be able to come into them to get their shots if they're sick or vulnerable or elderly or have mobility issues. And then a lot of people come with their family member, to help translate, or to, and if more people are, reluctant to do that or not able to do that, if there's a work requirement, then I think a lot of the support networks that people have to like get the rates and coverage and health, care and other things that people need now, that could be, harder in the future. So the work requirements, I think we'll see how that plays out. But it does seem like it's like a budget cutting measure that is going forward. And I don't know, a lot will affect, different communities all across the country. It's going to be an issue.
To find out where you can get vaccines in New York City, visit the NYC Health Map. If you would like more information about vaccines, visit our webpage at institute.org/vaccines saves lives.
You've been listening to the Bronx Health REACH podcast. You can email Bronx Health REACH at bxhealthreach@gmail.com. You could find Bronx Health REACH on social media. For Facebook, Bronx Health REACH. For X and Instagram, BX Health REACH. And on Blue Sky, bxhealthreach.bsky.social. The views, thoughts, and opinions expressed and presented by our guests here on the Bronx Health REACH podcast are their own and do not necessarily represent the views, thoughts, and opinions of Bronx Health REACH and the Institute for Family Health.